So is present. Honorable Carl Slater.
Present.
Yes, thank you. Honorable Carl Slater is present. Honorable Paul Begay.
Delegate Paul Begay is present.
Thank you. Honorable Paul Begay is present. Honorable Pernell Halona. Honorable Pernell Halona. Honorable Charlene So. Honorable Charlene So. Honorable Edison Wanika.
Here.
Thank you. Honorable Edison Wanika is present. Chairman, we have 4 members present upon roll call and 2 members not entering roll call. Chairman?
Okay, hello. So we reestablish quorum. Ms. Spencer. Oh, committee members, we exited the executive session. How do you want to proceed?
Motion to accept the report.
Thank you. Chair accepts the motion by Honorable Vice Chair Slater. Do I hear a second? Second, Wanika. Oh, second by Honorable Edison Wanika. Staff, could you provide us the roll call on the motion to accept the report that was provided in the executive session?
Sure, Chairman. So roll call vote on the report. Honorable Carl Slater, how do you vote?
Green.
Thank you. Honorable Carl Slater votes green. Honorable Paul Begay, how do you vote?
Delegate Begay votes green.
Thank you. Honorable Paul Begay votes green. Honorable Pernell Halona, how do you vote? Honorable Pernell Halona. Honorable Charlene So, how do you vote? Honorable Charlene So. Honorable Edison Wanika, how do you vote?
Green.
Thank you. Honorable Edison Wanika votes green. Chairman, we have 3 members voting in the affirmative, 0 opposing, and chairman not voting, and 2 members not voting. Chairman?
Yeah, no. Miss Laureen Spencer, the next item on the agenda, please review with the committee.
Thank you, Mr. Chair and members of the HES committee. So the next item will be C, update regarding U.S. Department of Health and Human Services Centers for Medicare and Medicaid Services. Response to acknowledge and comply with Navajo Nation health safety protocols and safety measures. Presenter will be Lashana So, Executive Director, Navajo Nation Washington Office. Dr. Jill Jim, Executive Director, Navajo Department of Health. Thank you.
Thank you, Ms. Spencer. Is Ms. Lasana So on the call?
Yes, sir, I am present.
Yeah, Asa Tui.
Oh, yeah, it's Aisha Che.
Okay. You may present, and then we'll go to Dr. Jill Jim, and I think Dr. Jim has a distinguished guest also to talk to the issue.
Thank you, and good afternoon. Chairman So, Vice Chair Slater, and members of the HES committee. I am Lashana So, the Executive Director for the Navajo Nation Washington office. It is a pleasure and an honor to provide an update to you all regarding in a matter that took place recently at one of our nursing homes. And as a follow-up, I was looped into the conversation on August 30th. A request was made to CMS for a meeting with Navajo Nation leadership, President Nez, Speaker Damon, Mr. Wayne Claw, the HESI committee, and Navajo DOH to discuss the incident at Navajo Land Nursing Home related to CMS surveyors, masking mandates, and self-test kit recommendations. We immediately contacted CMS to schedule this meeting, and that meeting took place on September 1st, where a call occurred with the Navajo Nation leadership, President Nez, Chair So, and CMS Center for Clinical Standards and Quality. Specifically, those that were on the call were David Wright, Carol Susan, Karen Trix, David Wright, Kitty Marks, and William Harris. Also on the call from Navajo Nation was Sherilyn Yazzie, Chief of Staff for the Office of the Speaker. During this call, we did share with them the concerns that were brought forth, which CMS leadership acknowledged and did state that they would be following up with their team internally to ensure that they follow Navajo Nation laws and executive orders for future visits. That was the conclusion of the call. I'll defer to Dr. Jim or her proxy to share additional information regarding this call. Ahiahat.
Thank you, Ms. Lashana So. Dr. Jill Jim?
Chair So, this is Michelle Morris from Department of Health. I apologize. Dr. Jim informed us that she's currently on another federal call and she's not able to attend, but she did defer the same information that Lashana provided as a report.
Okay. And committee members, basically the folks on the call from the Department of Health and Human Services, they took our recommendations and our urgent matter under review, and they were going to issue their own directives to the folks that come out to Navajo Nation. And as far as I know, that and we asked that that directive memo going to their staff or their surveyors, subcontractors, be that they share that correspondence with us. And as far as I know, that hasn't occurred. Ms. Lashana So, am I correct?
Ahiahat. As far as I know, I personally have not seen any correspondence after the call had taken place. I am happy to follow up with Dr. Carol Susan and her team.
Yes, thank you. We appreciate that. You know, it happened, it occurred so quickly. We had Office of Legislative Counsel work on a memo. Miss Loya Henderson, are you on the call? I know that she had a
Yes,
draft.
I'm here. Sorry about that. Yes,
Yeah.
I am here, Trista.
Okay. Regarding that letter, let's do a redraft of that initial letter since Ms. LaShawna so facilitated a meeting real quickly from when that issue came before the committee. Can you collaborate with Ms. So to draft a letter on behalf of the committee?
Yes,
to
I
be
can do
sent
that.
to those. Yes, and Ms. So, if you would collaborate with Ms. Lawyer Henderson, and in that way the letter can come from the chair and the vice chair of the committee.
Yes, sir.
Sorry. Sorry for the interruptions. Go ahead.
I was just acknowledging Chairman's recommendation. Happy to collaborate with OLC.
Great.
And thank you.
Yes, you answered almost simultaneously, and we appreciate that collaboration and establishing those links. With that, committee members, I think that would basically cover the issue. Remember, it's an issue that Mr. Wayne Claw brought to our attention, where the surveyors at the Guy Gorman Center would not basically submit to a self-test or to even wear a mask. And that issue went right straight up to, thanks to Ms. LaShawna, so right within a few days, right up to the top. So we think that issue will be resolved with that correspondence to their surveyors. So that's what we'll follow up on, committee members. Do you have questions?
Motion to accept report.
Thank you to the Honorable Edison Wanika. Accept the motion.
Second, that'll get McGay.
And second by Honorable Delegate Paul Begay. Staff, could we have roll call vote?
Yes, Chairman, so
Miss-
roll call vote on the accepting the report. Honorable Carl Slater, how do you vote?
Green.
Thank you. Honorable Carl Slater votes green. Honorable Paul Begay, how do you vote?
That'll get McGay votes green.
Thank you. Honorable Paul Begay votes green. Honorable Pernell Halona, how do you vote? Honorable Pernell Halona, how do you vote? Honorable Charlene So, how do you vote? Honorable Charlene So, how do you vote? Honorable Edison Wanika, how do you vote?
Green.
Thank you. Honorable Edison Wanika votes green. Chairman, we have 3 members voting in the affirmative, 0 opposing, chairman not voting, and 2 members not voting. Chairman?
Thank you. Committee members, thank you, Ms. LaShawna So and Dr. Jill Jim. Miss Laureen Spencer. The next item for the committee to address.
The next item is D, update NVOH, Department of Behavioral Health and Department of Behavioral Health and Mental Health Services, Chinle chapter, Navajo Land Department. And the presenters will be Miranda Blatchford, Chinle Behavioral Health Service, Dr. Michelle Brancer, Dr. Joe Jim, Dr. Rosanna Jumbo Finch, Mike Colonna, and Honorable Eugene So, Council Delegate. Thank you.
Thank you, Ms. Spencer. Are the folks that were named off to present, are they on the call? Mike Colonna, Dr. Jill Jim, Dr. Michelle Brenser. And I remember Honorable Colonna, yes.
Hi.
Oh, sorry, I just will let you know I got back on the call. Thank you, Chair.
Hi, good afternoon, Chair. This is Michelle, Dr. Branzer with DBMHS. Sorry, I was trying to unmute myself.
Yes, the issue that we're trying to address is an issue that was brought to the committee's table by Honorable Eugene So and Dr. Jumbo Fitch regarding an access road right by the Behavioral Health Center in Chinle. There was a request to the division to see if they would allow access. And that would entail moving the withdrawn lands to the east from where it exists now. Tele, Eugene, so are you on the call? Okay, let me, I was hoping
Chair,
to get...
I'm on the call. This is Dr. Rosanna Jumbo Fitch from Chinle Chapter.
Oh, hey, yeah, hey.
Oh, yeah, hey.
And basically it's a, thank you for being on the call. Basically, give the committee some more background info on the request.
Yes, Chair. Thank you. Good afternoon, committee members. So on behalf of our current residents here at Chinle Chapter, we've had a request that has been submitted years ago, and Chinle Chapter has been constantly meeting with those local residents, and we have submitted documentation to the committee members here May 18th, 2022, that entail the presentation that Chinle Chapter has conducted. On that presentation, we shared the 6 dozen and more residents that reside within this location. We've provided maps, the information we reviewed in regards to home site, land use permits, and also the proposed access points. So during that meeting, we proposed that we have a route that connects directly to N7, Navajo Route 7, which would impede on the Department of Behavioral Health property line. So during that time, we proposed to have a corner of that particular land lot assigned to these residents so we could have access points for bus turnout, public turnout, medical turnout use. And we provided a map on that particular slide. Slide number 8 showed the existing turnout and also how we're going to connect to the Navajo Route 7. And during that meeting in May 18th, 2022, we discussed that it would move forward in regards to conducting a legal land survey and also confirming the environmental assessment. So Chinle Chapter would just want us to get an update in regards to where that process is currently at. We've been following up via email with Dr. Branzer and her team, and Chinle Chapter would like to report back to our community residents in regards to what updates may be available. So thank you, Chair.
Thank you, Jumbo Finch. So let's go to Dr. Brenzer.
Hi, everybody. Good afternoon again. And I apologize, a little under the weather here. So hopefully you can hear me fine. So for DBMHS, we have submitted our updated report, and the main thing that we have been able to accomplish, this has taken time to get the records and whatnot, because unfortunately we didn't have all that available, in the beginning even, I think. So the real update has been a request to Navajo General Land Development Department with Mr. Stephen Tischilly Jr., and that's for the land survey amendments with coordinates. DBMHS has been working with our health planner, Michael Salabai, to make that connection so we can get a land survey amendment with coordinates. And then also, that obviously that's needed for the land relinquishment or the transfer, so the community can have that road access they've requested. And so the other part that we have been able to accomplish is the cultural resources inventory determination was completed, and that's all been signed by the Heritage and Historic Preservation Department, BIA Navajo Regional Office. And then the other one is we're working on a service contract with Frontier Communications. As you may know from previous reports, there is a telecommunication line that has been across the property or the land that we're speaking about. So that needs to be relocated or removed. And so that's what we're asking. And we need a service contract to work with Frontier Communication regarding that relocation. And the last one update is that we do have a Chinle action plan for our outpatient treatment center there, and the changes that are going to be needed again for the request by the chapter in the community. So we are looking also at relocation because of the fencing that was put up as well around the property. But since we're going to be getting that resurvey and letting, providing that land for the community, we also need to relocate that fencing. And that's still updates I have for you all. So thank you.
Thank you, Dr. Brenzer. Committee members, any questions? If not, then Chair, thanks. Honorable Carl Slater, go ahead.
Thank you. I was just wondering, do we have any idea on what the timeline might be for getting this? And then the second question is to the chapter and how many people this will serve, and recognizing that, when it's added to the inventory, it will be a public road. So, it can't be cut off by anyone that it may lead to and connect through. So those are a couple questions and comments.
For Chinle chapter side, we had a document signed. We have over 64 residents that reside within this particular land area, and it doesn't include any of the public access routes, those that use it as well. It's just the permanent residents. We're counting about 64, sir. Thank you.
And this is Michelle, Dr. Brenzer, for the first part of the question. Thank you. I'll look at later. For timeline, we continue to follow up regarding that resurvey request. I haven't seen anything returned back just as yet, but we'll continue to follow because that will really determine our timeline that you're asking about. Thank you.
Thank you, presenters. So we really needed Mr. Halona on the call.
Chair,
I guess. Yes. Honorable
this
Vice
is
Chair
Byron
Sue.
Bitsui, the GIS Supervisor, Navajo Land Department.
Okay. Go ahead.
I'm
Again,
just here.
restate your name. Restate your name. There was a lot of static.
My name is Byron Bitsui, and I'm with the Navajo
Yeah,
Land
go
Department.
ahead. Go ahead.
My question is, with this access road, did they include that in the original land withdrawal or the relinquishment for the resurvey?
Miss Jumbo, Dr. Jumbo Finch.
I'm not too familiar with what request has been made. All the information has been funneled through Dr. Branzer and her team. We haven't been requested of any information to date.
Okay, that may be part of the issue. Is I know Mr. Alona was talking about making sure they add the access road to the land withdrawal that's been turned in with General Land Development Department.
Dr. Branzer.
Dr. Branzer. Yeah.
Yes. Yes, this is Michelle, Dr. Branzer. Yes, I believe it was indicated, but again, I'd have to go back and look at the application. But yes, I believe it was included. So I'm not sure, since it was, included, what the other issue might be. Thanks.
Mr. Bitsui, please facilitate that work. Dr. Branzer is, that land is withdrawn. It's, and the request was from Chinle chapter to modify that land withdrawal. Please understand that not everybody knows the nooks and crannies of what you're asking about. And so, and really, when Dr. Branzer and the division, they're being a good neighbor and saying, we're in Chinle chapter's community. This is a legitimate request. The way it is, I think the residents go on to a different area where it's not properly withdrawn, and they go on to other people's land use area. And if those land users built the fence to block off that unauthorized road, those 64 residents would be landlocked. And so, again, please communicate and work with Dr. Branzer and Dr. Jumbo Finch on this particular matter. The committee is facilitating this particular matter, and we're again the facilitator on this issue. Thank you.
Thank you, Chair. Navajo Land Department, we do understand. We'll do what we can. I'll get with Mr. Stevens Chili and see what they have so far as to withdrawn. I do have the facilities to do the mapping for the resurvey for the additional acreage, which is to be withdrawn for the access road. If I could see the area, because this is the first time I've heard of this, excuse me, sorry, but if need be, I can keep in contact with them as well from the Department of Behavioral and Mental Health. But we'll do what we can to help out the facility.
Yes, what it is a reduction in the land withdrawal that was long established for the Mental and Behavioral Health Services Center. And the reduction in the land withdrawal is what would be the access road. And so there would be a taking down of the perimeter fence and realigning it on the west side to allow for that access road. So it's not a land withdrawal for, and again, we don't know all the terminology that the land department uses, but it's converting a part of a land withdrawal to an access road.
Okay.
Thank
you, Chair.
Okay.
Like I mentioned before, I'll contact them and find out more information, and then that way we can understand it more, and then I can get with Stephen Chichili and with the General Land Development Department and Mr. Halona. Thank you.
Thank you, Mr. Mitsui. With that, Dr. Jumbo Finch and Dr. Branzer, that we cover all the necessary aspects of this matter.
Yes, sir. Chinle chapter will be on call for any information that still may be pending. We will be available via email, or we can meet on site or via phone call. So thank you very much. Yeah.
And yes, Chair, thank you. This is Michelle, Dr. Brancer, and committee that yes, whatever assistance we can get from the Land Development Department would be grateful. So thank you for that.
Great, thank you. Committee members, chair is open for a motion to accept the report.
Motion to accept report, Wanika.
Motion by Honorable Edison Wanika. Do I hear a second?
Yep. Okay.
A second by Honorable Paul Begay. Any questions or comments? With that, committee members, then let's go to a roll call vote. Ramona, please facilitate the roll call vote.
Yes, Chairman, so roll call vote on accepting the report. Honorable Carl Slater, how do you vote? Honorable Carl Slater, how do you vote?
Green.
Thank you. Honorable Carl Slater votes green. Honorable Paul Begay, how do you vote?
Gerald Gay votes green.
Thank you. Honorable Paul Begay votes green. Honorable Pernell Halona, how do you vote? Honorable Pernell Halona, how do you vote? Honorable Charlene So, how do you vote?
Ramona, Honorable Charlene So text that she votes green.
Okay, thank you, Chairman. Honorable Charlene So votes green via text. Honorable Edison Juanica.
Green.
Thank you. Honorable Edison Juanica votes green. Chairman, we have 4 members voting in the affirmative, 0 opposing, chairman not voting, and 1 member not voting. Chairman?
Thank you. Thank you for the vote, committee members. Miss Laureen Spencer, review with the committee the next item.
Mr. Chair and members of the desk committee, the next item will be item E, nomination E-rate consultant team seeking funding to continue and aid E-rate chapter libraries. Presenter is Brett V. Nelson and team members. Thank you.
Thank you, Ms. Spencer. Mr. Brent Nelson.
Yes, good afternoon, Honorable Delegate Chair and then also the Navajo the Education and Human Services Committees. And thank you for allowing us to provide an update report regarding the Navajo Nation E-Rate Initiative. And today I do have our E-Rate Consortium members that are online listening, and they'll be chiming in with updates as we go along with our update report. So, Chair, do you want me to have them introduce themselves, or do you want me just to go ahead and go straight into our update?
Yeah, let's see who's all part of your consortium.
Sure. E-Rate Consortium members, if you're online, can you please introduce yourselves?
Good afternoon, Chair. This is Pearl Lee, Program Manager with Navajo Nation Telecommunication Utilities.
Good afternoon. This is Paula Sinez with Department of Education.
Chair, we also have a Navajo Nation E-Rate consultant, Infinity Communications, that has an existing contract with Navajo Nation that will be joining in on the meeting here shortly. His name is Mr. Fred Brinkman. So just want to make that note. But thank you again, Chair So, and then also the Health, Education, and Human Services Committee. I had sent an email back in October, or a memo to the Health, Education, and Human Services Committee on October 13th, and I think you guys all have a copy of that memo relating to our request to support the Navajo Nation E-Rate chapter libraries. As you guys are all aware, the E-Rate initiative has been going on for the past 3 years, and our initial start was back in 2019, and in 2020 we got 56 chapters, sites to be identified as community libraries. So over those years, we've chose three different service providers. In that year, OSO Internet Technology was one of our service providers for the Rama Pine Hill area. And then we had Sacred Winds Communication. And then we also had, and they covered majority of the New Mexico sites. Then we had the NTUAW, which covered majority of the Arizona sites. So out of those three, that 2020 year, we had 56 sites that were funded. And altogether, we had actually submitted a request for all 110 chapters. But for that particular year, only 56 were approved. So moving forward, we've been working through the logistics of this E-rate program, which is funded through the FCC, of course, and there's a off of the FCC, there's a funding, there's a department called the Universal Service Administrative Services, they call it USAC, that has an E-rate program under there. So really that program helps subsidize costs for internet connectivity for libraries and schools across the nation. And we were lucky to have been awarded for our chapter libraries and our Head Start centers. So through these 3 years, we had serviced sites that were lit, those 56 sites. And we, as a consortium, we have various partners. We have one with Pearl Lee Shop with Navajo Nation Communication Utilities. And then we also have Department of Education. And then to a small degree, partnership with the Division of Community Development, since the chapters do fall under that division. But we've been working directly with the chapters, and through this, we've created service IGAs, agreements, and provided some training to each of these chapters on how to manage their chapter libraries. And that's being done by Department of Education under the Library Services, Mr. Donovan Pete. Once the chapter goes through these training deal, they are certified to open the doors for community members to use the chapter resources in their library section. Right now, the requirement for these services is to have one computer in each of these sites. We had donated systems that were provided through ADE. We also had donated systems that were provided through Division of Community Development. So we've fixed these systems up and made them available to these 56 chapter sites. Through this process, there's also, of course, fees that are involved, such as monthly internet service charges, and then also filtering. As we are all aware, in today technology and education, there's the Child Internet Protection Act that we have to comply with. So that same requirement is being implemented here with these E-rate connections that they call it SIPA filtering, has to be applied to each of the connected devices. So we've worked with our service providers, NTOAW and Sacred Wind Communications, and also to ensure that, you know, we not only are we providing 100 megs of connectivity to each of these locations, but those connections have to be filtered, have to be monitored. So there's a fee of that was provided. In this memo that I had sent out, there's a detail attachment of the monthly recurring charges information. So I hope you do have a copy of that, and it does break down the service providers. A good example is I guess, Chair, if I can maybe put a pause here. Do you guys all have that copy in front of you? But if not, I can give a quick highlight of it. So for N2AW in Arizona, for the chapters, the monthly internet service per site is $227.90. And the cost for monthly SIPA filtering for each site is $50. And there's a total of 24 sites that were under the N2AW Arizona contract. So there, for those 24 sites, there's a monthly internet service cost of $5,469.60. So you times that by 12, it comes out to $65,635.20. And then the monthly SIPA filtering is $1,200 a month for those 24 sites, and the yearly cost is $14,400. So there's a cost breakdown for that, and then we have the N2AW New Mexico sites. There's 5 sites on those, and there's a monthly internet service cost breakdown of that, and then the SIPA filtering. And the same thing for the Sacred Winds Communication. If you look on that sheet, you do have that breakdown of the chapters that are impacted. with the internet service per site, and then also the SIPA filtering. So, so over the past 2 years, the Navajo Nation Telecommunications and Utilities Department has been paying the monthly cost for internet service and SIPA filtering fees, which is totaling $9,296.15 per month, and averaging, and the total yearly amount is $111,553.80 per year for those 56 sites. So unfortunately, the funding to support these monthly costs are expiring January of 2023 from NNTU. Through DOTI, we've been advocating for various forms of available funding to continue to pay for the internet and SIPA filtering fees, but each request that we've been submitting, we weren't successful. So this is a critical situation, and DOTI continues its call to action campaign to see if we could seek some help from the council to help our chapters with the monthly recurring charges and internet filtering to support this E-rate initiative, to pay for the 56 sites that I had mentioned for year 2020. And we also are requesting to include any new sites that have been approved for USAC funding year 2021 and 2022, so that our students can continue to access the internet and its resources for educational uses. I provide this report to you, Chair So, and then also to the Health, Education, and Human Services Committee. And that completes my update, sir. Thank you.
Sure.
Committee members, any questions? Honorable Vice Chair Slater, go ahead.
Thank you. So I guess my first question is, what's the per chapter breakdown? I think you said it was $9,000 a month. And in terms of sustainability, yeah, I guess first, let me hear what the per chapter breakdown is and what the logic is behind that future cost not being shouldered by the chapter.
Pearl, do you want to provide a response to the Vice Chair Slater?
Good afternoon, everyone. Again, this is Pearl. In response to Delegate Slater's question, I can't speak to why the chapter is not putting any money into the cost. We've had a number of meetings with DCD, including Pearl Yellerman, the ASC project and program and project specialists. So we haven't been able to get any assistance from them at this point. But as far as the monthly costs for each of the chapters, the breakdown, we have 3 contracts with the service providers. We have an N2A wireless contract for our Arizona sites and an N2A wireless contract for the New Mexico sites. So in total, N2A wireless has 28 library sites and 12 Head Start sites that we're currently paying for, okay? And that costs the discounted rate, okay? So with USAC, how the funding works for the monthly reoccurring costs for internet services, basically what it is, the funding source USAC picks up 90% of that cost. So N2A charges us $2,279 per month for a 100 meg connection to each of those sites, okay? But we get a discounted rate. So they bill the USAC, the funding agency, the 90%, and then they bill Nation the 10%. And that 10% computes to $227.90. So ever since the sites have been coming online, which was, let me see, I think it was August, September 2021. Our office has been paying those monthly recurring costs for the internet and SIPA, okay? For Sacred Wind, they have 9 chapter library sites and 6 Head Start centers. And their full rate for the internet is $875, okay? But the discounted rate the nation pays is $87.50 per month for these sites. And then as far as the SIPA, that's the filtering that has to be on all of these sites. That is our contract with Sacred Wind. They're providing filtering to all of the sites, including Into a Wireless, and that comes at $50 per site. Okay, so that's the breakdown on it. So last year in fiscal year 2022, during the budget process, we requested for additional funding to within our telecommunication fixed cost account to supplement the or increase our budget to fund these sites. And I think we got almost 60,000 to fund the sites, okay? So we had that money in 2022, okay? But earlier this year, Jody prepared a fixed cost request in April, and they submitted it to OMB because they're the ones that request for all the cost projections for fixed costs. But they weren't awarded anything. They requested for a fixed cost, but they weren't funded. So our office did not request for any funding for FY23 because Doty was going to request for the funding. You know, they submitted their separate fixed cost requests. So that's why we're before you now. My current budget within the fixed cost telecommunication account doesn't have any funds to continue paying for the internet services and the SIPA filtering. So I think I answered your question. If not, you can restate it. Thank you.
Honorable Carl Slater, do you have follow-up?
Yeah, I do. Thank you. So in terms of coordinating the discount, is this something that really needs to be done in a central manner by Doty/NNTU? It's not something where the chapters could just take it on?
This is Pearl again. Right now, what's going on is as you all know, the broadband office was recently funded, and that office, as you know, is headed by Sonia Nez. They're in the process of updating or getting their plan of operation approved, okay? And within their duties and responsibilities, they've listed that they're going to oversee the E-rate project. So they are now going to spearhead all of that and work directly with Doty and the chapters and all who's involved in that project to ensure that the project continues and it's successful and all these little issues or major issues in this case get addressed. Right now, there's no real one office that is doing it. We're just trying to oversee it, you know, from all our divisions, you know, from my office, from Doty's office, but I think we really need assistance with Division of Community Development as far as helping with the funding from the chapters. So I'll leave it at that. Thank you.
Committee members, do you have any questions or comments? Honorable Vice Chair Slater, do you have follow-up?
Yeah, I guess I was trying to think like what's the smartest way to do this going forward. I understand in starting it to have it in a centralized manner. You know, I just see a lot of chapter budgets, and if it's $2,000 a month, that's quite expensive. But if that's then discounted by 90%, I would think they could cover that. What I want to know is, in order to get that 90% discount, is there a commitment in terms of the number of years that this has to be paid for or on in this manner, or is it just in perpetuity? Are there cumbersome like reporting requirements that would be annoying for chapters and more streamlined through, say, the telecom or the broadband office?
Thank you for that question or those questions. So there is somewhat reporting, but that's only tracking the, I guess, the community members that come in to use the library. So there's like a sign-in sheet. And then that sign-in sheet is used for like to track how many users are using the facility. So it's very minimal as far as tracking. And then as far as your first question, I was hoping our E-rates consultant was going to be on the line, but I don't see him on the line. But my understanding of the funding, each year when we apply, we get awarded sites, and those sites need to be completed. And so for funding year 2020, which runs July 1st, 2021 to, I'm sorry, July 1st, 2020 to June 30th, 2021, those sites all need to be completed. If they're all completed and then the internet is active and we're paying the bill, only after that, if a chapter decides that, or even the library decides that that site is no longer needed, then we can proceed with disconnecting that site. But remember, right now we have contracts in place. So our internet service contracts, they're a 3-year contract and they end June 30th of next year. So the contractor, or in this case, N2A Wireless and Sacred Wind, they may dispute that. So that's my response. Thank you.
Committee members? Any further questions?
Sure, I hate to belabor this, but I have one more question.
There's a lot of questions, but kind of filter out all this information. Go ahead, Honorable Vice Chair.
Like the content filtering on the the network. My question is, what was the justification that was provided? Was it by OMB for not including the allocation and the fixed cost numbers? Why do they say this didn't count as fixed costs?
Red, can you answer that? I wouldn't know.
Delegate Slater, I probably have to provide a response on that with our finance people and get that detailed information, sir. I don't have a right off answer.
Chair, I'll motion to accept the report.
Okay. I guess part of the confusion in my part is the per site per month. And again, it's it was a great selling job to go get the E-rate. Now comes part to pay for services. Have you made contact with the individual chapters respective of, let's say, their library or their Head Start center? And as such, then the library or the chapter, if their chapter office is right within the chapter house, then they would have the capabilities to use this service. Is that assumption correct?
Thank you, Chair So, for that question. When we first applied for USAC, the services at that time were the community library was only those eligible community members for the library are the only ones that were, I guess, eligible to use it. The chapter administration, USAC deemed them ineligible. Okay, so but recently, I think it was in April of this year, they made a ruling or issued a ruling that now the chapter admin people or the administration of the library, they can have access to this connection. So I think in August, we went out to some of the sites, my staff and I, and communicated that to the chapters because we wanted to look at those sites that were ready, that were set up, and make sure that they had everything in place. So at that time, we communicated to them that you can now use the connection. So if you want to move towards that, then we can work with you to disconnect your services and set up you to access the connection. But at this time, there's no chapter that wants to move over. I think for the Arizona chapters, $227.90 is a lot, and I think that's more than twice the cost of what they're currently paying. But I don't think they quite understand that this is a 100 meg connection. What they're getting now, probably through DSL, is a 1.5 meg. So we're still trying to address that as far as communicating and educating the chapter, about how big this bandwidth is and how fast it is, because it's fiber. What they currently have in most cases is just copper, and that's very limited. So we're continuing to reach out to the chapters. One of the things we had to do was attend the chapter planning meeting, the chapter regular meeting to present the resolution to get each chapter to approve the establishment of a chapter library within their facilities. And so I think all but maybe 5 have been approved. And we have a copy of all those resolutions on file. Thank you.
Chair, so this is Brent. If I can add to what Pearl just mentioned regarding the link.
Go ahead.
I think it's we're the fiber that Pearl is talking about and this whole E-rate initiative in year 2020 is roughly around $53 million initiative at no cost to the chapter or no cost to the nation in terms of building that fiber to the chapter. So it is a big investment into our communities to link a high capacity connectivity. Now, over the pandemic, we've all been involved with telecom, broadband. We need better broadband to our communities. We need to meet the demands of distant learning, telehealth, telework, all these different things, right? And we always heard, well, we don't have enough bandwidth, or we're running out of data, all these different challenges. With E-rate on a larger scale, with this initiative, we've opened up the trench to a certain degree with this initiative too, regards to broadband across the Navajo Nation. What the cost of to bring fiber to these locations, it's almost impossible for the nation to afford. But through this E-rate, we made it affordable for service providers to not only connect our chapters, but you've probably heard about fiber overbills, right? Throughout the past couple of years. Well, here we gave that opportunity to our service providers to do such. So now they can expand not only to the chapters, but to the homes to bring those high-speed capacities off of this network. So I think there's a lot of value to this E-rate initiative, and I think that over the past couple of years, we've heard all the possibilities in terms of really providing that connectivity back to our homes. So I wanted to make that important note, Delegate So, that this E-rate initiative is not only servicing the chapters per se, but we also gave opportunities to service providers to do fiber overbills and expand on their network. So just wanted to add that to the response of Pearl. Thank you.
Thank you. So I'll accept the motion by Honorable Carl Slater to accept the report. And really
Second,
what I
that was
see,
Jacob.
oh, thank you, Honorable Paul Begay. What I see is the need to report this matter to the NABI committee, the committee of the whole. That way they can send that message back to their respective chapters.
I think they already pay internet costs, and this would be an additional item.
Those are my thoughts. And if need be, the chair or the vice chair could facilitate putting this matter before the NABI committee members. Do I hear a second, committee members? Oh, excuse me. We have a motion and a second. Motion by Honorable Carl Slater, second by Honorable Paul Begay. Committee members, any further questions? If not, Ms. Ramona, could you provide the roll call vote?
Yes, Chairman, so roll call vote on accepting the report. Honorable Carl Slater, how do you vote?
Green.
Thank you. Honorable Carl Slater votes green. Honorable Paul Begay, how do you vote?
Green.
Thank you. Honorable Paul Begay votes green. Honorable Pernell Halona, how do you vote? Honorable Pernell Halona, how do you vote? Honorable Charlene So, how do you vote? Honorable Charlene So, how do you vote? Honorable Edison Juanica, how do you vote?
Green.
Thank you. Honorable Edison Juanica votes green. Chairman, we have 3 members voting in the affirmative, 0 opposing, chairman not voting, and 2 members not voting. Chairman?
Yeah, thank you, committee members. And Mr. Nelson, Ms. Lee, Ms. Inez, be prepared to present to the NABI committee. Ms. Lorraine Spencer, what is the next item on our adopted agenda?
Mr. Chair and members of the HES committee members, so the next item will be F, New Mexico Alliance of Health Councils. Overview of New Mexico Health Councils. Presenter Geraldine Antonio, Tribal Liaison, New Mexico Alliance of Health Councils. Thank you.
Thank you, Ms. Spencer. Do we have the presenter on the call?
Yes, Chairman. So I'm on the call.
You may proceed.
All right. Thank you so much, Honorable Chairman and also Vice Chairman Slater, and also the members of the committee. Yat A. She Geraldine Antonio Yanxia, Nanish Eja Tachini Nishlan, Tobash Aja Bashish Chin, Shihan Dashanella Ado Bashia Dashache. So thank you so much for this opportunity to present today. I am a tribal liaison and I represent a nonprofit organization in New Mexico. We are the organization, New Mexico Alliance of Health Councils. And I was hoping to come today before your committee just to do an overview of the work that we do and to possibly get some advisement from the committee on how to move forward and possibly engaging with some of the Navajo communities and, sharing some of the work that we do. So if it's okay, Chairman, so am I able to share screen and just do a few highlights of the presentation? And I had also sent an attachment to all the members of the committee last night. Chairman, so do I have the permission to share screen, PowerPoint?
Oh, I'm sorry. I didn't unmute. I was really talking away. Right now, I think the only one that is sitting before a computer is Honorable Vice Chair Slater. The rest of us are phoning in on our iPhones. So
Okay.
we could follow along if you had sent out your presentation. Is your presentation in PowerPoint format?
It is in the PDF format.
Okay. Let me search the files for what you sent in. Personally, I got, as of today, more than 87 emails, so it's quite quite the.
And if needed, I could also send the email so it pops up at the top of the inbox.
You have all the committee members' emails, right?
Yes, yes, Chairman.
Okay. Go ahead, send it out.
Okay, and the presentation just sent by email just now.
I have my regular inbox and the spam box. Oh, here, it just came in.
Okay.
I just got it, Chair. So I hope everyone else does.
Hmm.
You need E-rate
I
to your
haven't
house,
gotten
right?
mine. I'm way out in the boonies right now, so it might have went by Pony Express rather than email.
Okay, Chairman, so would you like to begin?
Yes, yes. Go ahead and start your presentation.
Okay, all right, thank you so much. So I am representing an organization called the New Mexico Alliance of Health Councils, and we are a statewide nonprofit organization. And our mission is to support the health of New Mexicans and also tribal communities. And what we do is we support community-based health planning teams who are actually located across the state. And we focus on advocating for health equity, but also uplifting community voice. So what we do is we offer a lot of training, technical assistance, opportunities for learning sessions, peer learning sessions, especially among tribes to tribes. And I could talk a little bit more about that. So a little bit of our focus strategies for our organization has been around promoting equity, health equity, diversity, and inclusion. Supporting and helping strengthen capacity building for the health councils that we're currently partnered with, and also building the internal operational infrastructure for the Alliance. So if you go to slide number 5, we're actually mandated under a House bill, which was passed by the New Mexico legislature. And this House bill is referred to as the 2019 County and Tribal Health Councils Act. So this act here actually reaffirms some of the functions of health councils. And when I say reaffirm, health councils actually have been in existence since 1991. And it wasn't until 2019 those functions were reaffirmed. So some of those functions that a lot of the county and tribal health councils have is to focus on community-based planning, assessment, prioritization, and to also look at what are some of the community resources, programs, and identifying some of those gaps and some of those duplications and some of the services, but also looking at community prioritized solutions. And in many cases with the tribal health councils, that does include some of the traditional and culturally relevant interventions. And so those are some of the primary mandates. And in addition to that, they also focus on advising local and state government on some policies to improve community health. And so these are some of the main mandates that have been given to tribal and county health councils. And if you move to slide 7, we do have here just an overview of the county and tribal health councils that we work with. So if you're not familiar with our organization, we actually have a county health council in all 33 counties in New Mexico. And we're currently partnered with 9 tribal communities. So on the right side here, you can see that our organization has primarily been partnered with most of the Pueblo nations, which include the Pueblo of Acoma, Cochiti, Nambe, Picari, San Ildefonso, Santa Clara, Santo Domingo, and Tesuque. And we're currently partnered with just one Navajo community, which is from Tohajale, New Mexico, and they're currently housed under the Canyoncito Band of Navajos Health Clinic. So as you can see here, the reason why I'm coming and reaching out to the standing committee is to hopefully gain some advisement on how to move forward, because we would really love to increase our partnership and collaborate more with the Navajo communities. And it's such a vast nation that, I think the organization can get to some of the Pueblo leadership and maybe some of the Apache leadership, because they're such smaller communities. But when it comes to the Navajo Nation, I think for the longest time, our organization has tried to strategize on what the best approach would be. And we felt like, the standing committee would be the best approach and provide a lot of recommendations for that. So moving forward on slide 8, similar to a lot of the Department of Health at the state, as well as some of the functions of health councils, and similar to also some of the Navajo Department of Health functions, we're basically encouraging and also emphasize the work of the 10 essential public health services, again, which is to do a lot of community assessment, utilizing data to drive some of the solutions, and also to continue to inform and educate community members, and also to work on policy development in partnership with tribal leadership, and also continuing to monitor, some of these health outcomes in the community, health priorities, and to also build organizational infrastructure. So health councils, again, also do kind of follow this model of the 10 essential public health services. On slide 9, this is important because, with a lot of the tribal communities that we work with, a lot of them, those who represent the health council do come from community, which we really highly encourage, just because they understand a lot of the cultural and traditional context of what it means to be a unit and come from communities. So these health councils, the idea is to uplift community and to allow community to provide a perspective, whether that would be maybe at a chapter house level or at a higher level with tribal leadership. Again, looking for some advisement on how to move forward with that, but definitely in our work now with the Pueblos and some of the Apache nations moving forward, being very respectful of the process of tribal sovereignty, but also leadership to get approval to move forward, to engage with some of the communities and what is the proper protocols to do that. Also recognizing that this is probably not anything new to the Navajo Nation. I'm sure there's a ton of coalitions and tons of work groups who are doing this type of work, but just don't refer to themselves as health councils. And we're just looking for some opportunities to partner and to kind of move this work forward, and also kind of just engage with some of the Navajo communities, in our state. And I think one thing that tribal health councils bring that is so different from county health councils is the perspective of culture and wellness, and what that means to community, and how it's a very holistic approach to health, and also some of integrating a lot of those metaphysical aspects of health when it comes to spirituality, faith, and some of those things of our connection to land, air, water, and earth. So I'm coming here hoping that I could gain some direction, and also being very mindful of these proper protocols. And moving to slide 10, you can see here, if you're familiar with the All Pueblo Council of Governors, our organization has been partnered with them, and they support some of our work to move forward. So we are very focused on also including tribal leadership in a lot of the work that we do, and keeping them informed, and also communicating and some of the efforts moving along with tribal health councils. So we recently received a lot of support from them, encouraging other tribal Pueblos to consider maybe partnering or developing a tribal health council or health committee, to represent their tribe, to be part of this. And, there's been a lot of growth and interest in health councils in the state. And our organization actually hasn't had a tribal liaison in a very long time. So I'm actually doing a lot of the groundwork here. I'm hoping to just start a relationship and, continue to move forward with the Navajo Nation. On slide 11 is kind of just referencing how important health councils are. We actually work also in collaboration, not only with independent tribal public health systems, from where each tribe comes from, but also we are currently partnered with the New Mexico Department of Health. So this just allows us to also create that partnership, or also provide other resources that the state can also provide. So again, why this is so important, New Mexico is a centralized statewide health department, and health councils actually play a key role in a lot of the community-based health planning, assessment, and action. So they can provide a lot of that information to the state level. But again, for tribes, that's very different. They don't have, they're not obligated to share any of that information. And as far as the accreditation process for each tribal program and department, also, health councils are part of the statewide public health accreditation process. So you can see that they're very useful in the types of contributions and outcomes that they have in each of their communities. And we actually work very closely with Department of Health's Public Health Division, and also some of their health promotion regional team managers. And this is just our way of developing some vital partnerships to improve population and community health, and also addressing some of those health disparities and health outcomes. On slide 11, I made some reference to, which is a House Memorial 2, was a public health task force recommendations. So in 2021, the New Mexico legislature actually passed HM2, which is a public health task force. And their primary responsibility was to assess and analyze the current public health infrastructure of New Mexico and make some recommendations for improvement. It's a pretty lengthy report, but obviously tribal representation and tribal concerns were also part of this report. And also another big part of this report is also looking at building the capacity of health councils, which they were listed as a priority in this task force. So there has been much emphasis placed on health councils throughout the state. And I think another big part of this is also the tribal representation. We've been developing relationships, and we've got health councils right now who are currently on standstill with leadership that they're just getting approval to, get on board with our organization. But I just wanted to share that because this is also stuff happening at a state level. We also help inform some of the tribal health councils on some of the legislative stuff happening at a state level, and also some of the resources and funding and other things that our organization can offer, which I can share with you here at a later time. And slide 13, 14, and 15 actually just gives a rundown of some of the work that we've been doing for the past 2 years. We actually received a really huge grant from CDC. And so some of this work, year one has been focused on vaccine equity. just because of the COVID-19 crisis that's has happened. And the tribal health councils who we have worked with actually have been part of the community process and planning for community vaccinations, education, outreach, awareness, also doing food drive, food and water and PPE and some of those other essentials, some of those drive-throughs, and providing community with as much information as possible to get the vaccine rates up, but also to address vaccine hesitancy. So some of the impacts of the funding from last year, there are actually health equity committees that have been developed in each county health council and tribal health council. And the idea was to really place some emphasis on health, equitable approaches to health, meaning not just talking about representation or who's at the table, but really looking at some of those organizational internal development structures, like your policies and bylaws, and who are your stakeholders, who are your partnerships, who are you missing. So these health equity committees actually open the door to a lot of different perspectives of health, and kind of restructuring some of their health councils to be very inclusive, to different populations in their communities. And going to slide 14 here, some of the impacts that we've had in the state with county and tribal health councils is obviously an increase in collaboration and partnerships with Native-led, Native-serving organizations, with state-level resources with grassroots organizations, and also just the increase of collaboration among internal tribal programs and departments. And also some of the support that we've been receiving across the state have been from community members, healthcare providers, some of the state agencies, and other volunteer organizations. And again, some of those who work closely, for example, could be some of the MCOs, and more recently IHS, and some of those other key partners that tribes are have been working very closely with. On slide 15 here, again, just gives an overview. Some health councils have been doing some advocacy for a very long time. Some are that capacity to do some of that at the state level and also local level. And some of those priority areas have been mental health, obviously the COVID-19 pandemic crisis, substance abuse and use, and also looking at the health impacts of climate change. So as you can see here, there's been a lot of development with health councils around advocacy and policy. Moving to slide 16, I just gave an overview of some tribal health council health priorities. So these have been identified by the community through the health council. So you can see here from 2021 to 2022, with the 9 tribal partners that we do have, some of their priorities have been, of course, COVID-19, focus on health equity, focus on cultural and language preservation, access to healthcare, physical activity, mental health, family development, healthy food and eating, transportation, suicide prevention, and partner violence. So these are just some of the ones that we wanted to highlight. But again, similar to some of the challenges that Navajo Nation also probably has prioritized for through the Navajo Nation Department of Health. Slide 17 and 18 is actually around capacity building. So when we think about how well programs and services are offering, some of the services to community, I think what's important to also understand is the capacity of those departments and programs. In this case, it's the capacity of the health council. How well internally are they developed to be able to carry out a lot of these tasks? So what our organization has been working on with tribal health councils is building the capacity, and slide 17 outlines some of those capacity domains, which is around organizational systems, resources and funding, communications and marketing, stakeholder engagement, planning and prioritization, and outlining outcomes and impacts, and most importantly, with making sure that through all of these different domains, we're also considering equity to be a key component of it. So on slide 18, with the partners that we do have you can see that there's been a lot of prioritization around organizational development. And this is just because some may have new leadership, some may be restructuring their health council, but some are probably just developing some bylaws. You know, some of the most basic structural things are some of the things that they've been focusing on in some of the Pueblos. Other types of priorities include stakeholder engagement, again, increasing partnerships. Who's missing at the table is tribal leadership representative at, you know, a lot of these functions. And then some have been focusing on equity and others have been focusing on other key elements like resources and funding, how well they're communicating with community through communications and marketing, and then also planning and goal implementation. On slide 19, this is more recently, the state of New Mexico is actually doing a state health improvement plan. And part of their work, what I should note that I'm not a representative of Department of Health from the state, but the organization I work with works in partnership with them. And so what they're currently doing now is this process, a state health improvement plan. And what they're doing now is working with county and tribal health councils, but also looking to work with other tribal communities to truly understand some of those community priorities and how to shift the narrative, you know, make community priorities state priorities, because I think with our state, that narrative has always been flipped. So we've been also doing some training and technical assistance with tribal health councils on how to do a community health assessment, how to develop a community health improvement plan for your specific population and area that you work with. And definitely not required. They do not have to feed any of this information into the state, but we're definitely encouraging some of the tribal communities to at least consider doing this at a local level, just for the improvement of their own local communities. And then slide 20, you know, this is some of the support services that we provide. Funding, looking for funding and training opportunities. We also support capacity building and internal organizational development. Resource development, looking for partnerships for health councils, providing technical assistance, and then addressing some of those challenges that may come over time with tribal health councils. And so, so slide 21 just gives an overview. There has been some history of underfunding for health councils. And you can see by this graph that we're slowly moving, you know, we get funding from the legislature through DOH. So this funding is allocated to DOH and funding given down to health councils. So, you know, you can see here that there's clearly evidence of history of underfunding for health councils. And we've been doing a lot of advocacy work for this. You know, working with some of the state legislators and also the governor's office for the state of New Mexico. On slide 22, it does kind of give an outline here, you know, what each health council receives from the state, which is about, was 9,000, but currently 9,000 per health council, which is still not enough funding to even fund a full-time employee or someone to kind of coordinate this health council. But we've been doing tons of advocacy around this and going before legislature this year. So on slide 23, it outlines that we're asking for support for 6.3 million funding package, which is going to support the organizational development of the alliance, but also health councils, each individual county and tribal health council. And in addition to some of this funding, we've also received funding from CDC and Kellogg, the Robert Wood Johnson Foundation, the McCune Foundation, and some other grantors that also support the work of health councils. And so this is not just limited to just this funding, but we've been also doing a lot of other, you know, a lot of work around finding grants to get funding for health councils. So on slide 24, I try to give a quick overview, but really what I came here today before the committee and also is to kind of just get some advisement on how to move forward and, you know, with engagement for tribal communities. So, you know, through the Pueblos and Apache nations, the process seems to be much different. And especially with your purpose on serving on the committee, focusing on some of the priorities around delivery of social services and health services, education initiatives, and other related activities, and also supporting local communities and other community-based organizations. If it's not at this time, I would also, just love to get some recommendations on how to move forward, and if there's a proper protocol to move forward from here with our organization. So, Chairman, and members of the committee, that just about sums my presentation. And I'm happy to answer any questions or, however we decide to move forward.
Thank you for the presentation. Committee members. How do you wish to proceed? Yes, I kind of, your presentation's a little bit overwhelming.
Mm-hmm.
And more than likely, all the issues that you've identified is probably overwhelming to certain communities. It's a lot of items you wish to accomplish, but what are realistic? What are the realistic items? That would be the thought to narrow down the presentation. Just from experience, 12 to 15 slides. You have a certain time where you have an audience. And so what you've done is put a lot of needles on the table, and you want us to thread the needles. Now, which one of these items is your priority? What is accomplishable? I think is what I would advise to narrow down your presentation. That's a lot of items that you want to try to accomplish, but what are the realistic ones? Which are the ones that would be most acceptable by the communities? Those are my thoughts.
Thank you, Chairman. So yes, yeah, I came in hoping to really share a lot of the work that's been happening. Again, a lot of the tribal communities, they actually don't have to really address or make a lot of these the priority. We allow a lot of the communities that we work with to identify their priorities. So whether that would just be one focus area of capacity building or possibly a health priority, we just support whatever the community believes is important to them. And my presentation probably encompasses a lot of those accomplishments and priorities, which I thought I could share is, it encompasses a lot, just beyond health, but also with organizational development. So thank you for your comment.
Committee members, chair is open for motion to accept the report.
Motion.
Motion by Honorable Vice Chair Slater. Do I hear a second?
Second.
Second by Honorable Edison Wanika. Any further comments or discussion? To the presenter, you know that the Navajo Nation is totally distinct and separate from even the Apaches, even the Pueblos. We're made up of chapters. And your work and funding scheme comes from the New Mexico legislature. And it just seems like your focus would be to the 54 chapters that exist in New Mexico. I would get the list of the chapters. Most everybody to get on their chapter meeting agenda have to present at the planning meetings. And so that's where the inroads start with what you're trying to do. And so that aspect I would highly recommend. And for myself, I'll extend the invitation once I get notice of the chapter meetings that will be conducted this month. No, in November. You do have your email posted on your presentation?
Yes, I do, Chairman. So
Okay. So let's proceed in that manner. And then the other step is on a quarterly basis, the Eastern Navajo Agency Council meets on a quarterly basis, and that's where the 31 chapters that make up Eastern Agency convene together. And then, of course, the Northern Agency Council, I think, composed of 15 chapters. They also convene on a quarterly basis. And so those are they make up the New Mexico chapters. So that would be my advisement.
thank you, Chairman So and members of the committee. Yes, I would, if there's any further follow-up after this, I would be happy to meet individually. So thank you.
Agushin, committee members, and any other thoughts before I call for the vote? Okay, Ramona, Mr. Ramona, please provide the roll call vote.
Yes, Chairman So, roll call vote on accepting the report. Honorable Carl Slater, how do you vote? Honorable Carl Slater.
This
how
is
do you vote?
Delegate Slater. I vote green. Sorry.
Thank you. Honorable Carl Slater votes green. Honorable Paul Begay, how do you vote?
Green.
Thank you. Honorable Paul Begay votes green. Honorable Pernell Halona, how do you vote? Honorable Pernell Halona, how do you vote? Honorable Charlene So, how do you vote? Honorable Charlene So, how do you vote? Honorable Edison Juanica, how do you vote?
Green.
Thank you. Honorable Edison Juanica votes green. Chairman, we have 3 members voting in the affirmative, none opposing, and Chairman not voting, and 2 members not voting. Chairman?
Thank you. Appreciate that, committee members. And let's move forward on our agenda. Ms. Laureen Spencer. the next item before the committee.
Thank you, Mr. Chair and members of the HES committee. The next item is 6 old business, there's none. And then 7 new business, A, legislation 0194-22 will be next for consideration, Mr. Chair.
And the sponsor is?
The sponsor are Delegate Carl Slater and co-sponsored by Otto So.
Okay. And this legislation has been read into the record.
Not yet, Mr.
Committee.
Mr. Chair.
Oh dear. Okay.
I can go ahead and read it.
Please do.
Tracking number 0194-22, an action relating to resources and development, budget and finance, and Navajo committees, approving and authorizing a renewal contract between the Navajo Nation and the United States Department of the Interior under 25 USC Section 5301 at CPL 93638 as amended for a 5-year term for the Indian Child Welfare Act program beginning January 1st, 2023 and ending December 31st, 2027, approving and authorizing the fiscal year annual funding agreement and scope of work for the period of the contract term. So attached is the document. As Exhibit A is the agreement between the Secretary of the Department of the Interior and the Navajo Nation. Following that is the fiscal year 23 annual funding agreement between the Navajo Nation and the United States Department of the Interior. And following that is a budget summary, the Navajo Nation summary of a proposed budget regarding Indian Child Welfare Act Program Division of Social Services. That budget is attached, and Exhibit B is the Section 164 review form from the Division of Social Services and has gone through OMB, OOC, OAG. And then following that is the Navajo Nation Department of Justice document request form. The Navajo Nation Division of Finance, Office of the Controller. And it's gone through the 5-day comments, and there are no comments received. Mr. Chair, thank you.
Okay, thank you, Ms. Spencer. Thank you for keeping the chair on track. Committee members. Chair is open to a motion to adopt proposed legislation.
Motion, Wanika.
Thank you, Honorable Edison Wanika. Motion accepted. Do I hear a second?
Second, Delegate J.
Okay. Thank you. Miss Angelica Benali, could you text the HES committee members, get back on the call? This is a very important piece of legislation, and I really appreciate it if the full membership was to vote on it. Thank you.
Okay.
Tele, Honorable Vice Chair Slater, let me give you some time to provide an overview of the proposed action. Do we have Ms. Loya Henderson still on the call in case there are pertinent questions? And then from the Department of Justice, who would be your agents Honorable Vice Chair.
This
Thank
is
you.
Loya Henderson. Sorry. Still here.
Great. All right, let's proceed. Honorable Vice Chair.
Thank you very much, Chair. I'll be very brief and then hand it over to the program manager and then also to Ms. So. They're going to be the agents. Mary Deschini Reina is the program manager, and then Ms. Crescencia So is, are you a senior? Are you the principal social worker? Yes,
Yeah.
okay, the principal, and then the other half of the dynamic So duo, Ms. Lashana So. So moving on, I want to bring to your attention the PowerPoint that the program developed and I sent out to the committee yesterday. The second slide, there's 4 different highlighted, I think, new positions that are proposed staff members to be funded under this agreement. But we're all familiar with these contracts and how they function. You update your scope of work, and that's how they move forward with funding it. So this is the ICWA program, and I know that we've been very invested in supporting this program and have done things also to support the Department of Justice and seeking decisions that are better for our Navajo kids all across the United States. So I believe it's every 5 years, that we bring forward this funding agreement and the relevant scope of work. So committee members, if you need me to send it out again, I just chime in here and let me know. But I'll let them move through the PowerPoint. In essence, we're just the first part in this reauthorization process. I want to bring to your attention that if you go to the website or if you see the email, there was a reassignment of the legislation. In error, it listed the Resources and Development Committee instead of the Health Education Human Services Committee. And so Ms. Henderson, Hanaafni Henderson, has developed an amendment to rectify that issue. So as the sponsor, I'll be respectfully requesting that someone sponsor that amendment. I don't think I can amend the legislation myself, and we'll correct the title. Then I'll move on to the Budget and Finance Committee, ideally next Tuesday, and then NABI thereafter, and that will finalize the renewal of the contract and the scope of work for the funding for the contract. So with that said, I would love to have more co-sponsors for the legislation. And I think just because the HES committee has been really invested in ICWA issues at the DOJ and program level, it'd be a strong sort of show of support to the rest of the council that we're standing behind this. But I won't steal any more thunder from the program, and they can go over the rationale for the changes in the scope of work and the contract. So Ms. Deschini Reina, I'll hand it over to you.
Thank you, sir. Good afternoon, Honorable Chair, Honorable Vice Chair, members of the committee. My name is Mary Deschini Reina. I am the program manager for the Navajo Indian Child Welfare Act program. Today, I will present to you the Navajo ICWA program's 5-year annual funding agreement renewal with the United States Department of Interior, Bureau of Indian Affairs. I believe our information packet was sent to you yesterday, and it can be referenced as we continue through this presentation. Beginning with slide 2, this shows our organizational chart and identifies the ICWA staff details. I am happy to have this opportunity to inform you about my ICWA team. First, I want to tell you this team consists of some very skilled staff with big hearts who are amazing at what they do. They are supervised by a unit supervisor who's a PSW and is a known subject matter expert in the ICWA arena, Ms. Crescencia So, who I'm very fortunate to have with me today. ICWA is a program that can be very complicated to understand, and as it deals with very complex issues surrounding the Navajo children who primarily live off the nation. If I could, I would spend the time to boast of their advocacy efforts within the courts and the state child welfare agencies across the United States. They advocate why it is important for our Navajo children to grow up in our Navajo homes, why their self-identity is so important. They advocate for our clanship, our language, our ceremonies, and why it is so important that every minute we spend with our families, relatives, and communities is an opportunity to learn something about who they are as Diné children and where they come from. We ended the fourth quarter with this team having a total of 366 active cases involving 693 Navajo children. This team makes sure the states and the courts follow the federal law, because due to this lack of knowledge to this federal law, some courts have made placement errors, or some managed to believe that our Navajo child is best placed in a non-native, non-Navajo home instead of with us. So again, my team fight for, and they are the voice for, and are the protectors of our Navajo children who live off the Navajo Nation. They fight in the courts, they fight for the rights of our heritage to state agencies across the United States to protect and preserve our lineage of our Navajo youth. I'm so proud and humbled to work with each of them and thank them frequently for their work and for giving so much of themselves. The org chart reflects current staff of 15 with 2 vacancies. With the proposed 4 staff, we'll be looking at a team of 21. In this presentation, we will explain the need for the change of the scope of work, the need for a clinical social worker, and 2 additional social workers who will be placed in the Phoenix metro area. So with the organizational chart, you'll see, hopefully you're able to identify the colored areas. There are 2 green areas, which are the 2 vacant positions identified as the administrative assistant and the social worker. You'll see 4 highlighted yellow areas identified as a clinical social worker and 3 senior social workers, 2 of which you will see are under the Phoenix, Arizona section, and 1 here in St. Michael's.
Miss Deschitney Reina.
Yes.
I'm so sorry to interrupt your presentation.
No, that's okay.
Our sponsor, Honorable Carl Slater, just texted us that he needs to be on the road. So I'm going to ask the committee. We will hear this again at NABI. And so in that aspect, let's defer to the presentation and go forward with Amendment 1. If we have a motion and a second, then I could divert to Ms. Laureen Spencer to read the amendment into the record, and then we'll go for the adoption of the legislation. Again, we are so bought into this process, and we thank Department of Justice, Attorney General for doing some corrections and then also providing additional support. Committee members, chair is open for a motion to amend with the amendment that was sent out yesterday by Ms. Loya Henderson, and again with Honorable Carl Slater. A motion and a second for amendment, and then we'll have it read into the record. Committee members? Committee members, motion to amend.
Chair, so, Delegate Begay, I to make a motion for the amendment that was brought up a while ago. Make that motion.
Uncle Sheila. Thank you, Honorable Paul Begay. Committee members, do I hear a second?
Thank you, Monica.
Thank you, Honorable Wanika. We have a motion and a second. Miss Lorraine Spencer, please read the amendment language into the record.
Yes, Mr. Chair and members of the HES committee. So amendment will be on page 1 at line 11, delete resources and development and replace with health, education, and human services. And then if there's any to renumber or reletter succeeding paragraphs, sections, and exhibits as necessary and appropriate. Mr. Chair.
Thank you. Any question? I think it's very clear. So let me take it to a vote immediately. Ms. Ramona, roll call vote on the amendment.
Yes, Chairman So, roll call vote on the amendment. Honorable Carl Slater, how do you vote?
Green.
Thank you. Honorable Carl Slater votes green. Honorable Paul Begay, how do you vote?
Green.
Honorable Paul Begay votes green. Honorable Pernell Halona, how do you vote? Honorable Paul Halona, how do you vote? Honorable Charlene So, how do you vote? Honorable Charlene So, how do you vote? Honorable Edison Juanica, how do you vote?
Green.
Thank you. Honorable Edison Juanica votes green. Chairman, we have 3 members voting in the affirmative, 0 opposing, chairman not voting, and 2 members not voting. Chairman?
Thank you, Mr. Ramona. I just want to take it to a vote immediately with the amended legislation. Committee members, please understand the situation we're in. And to staff, I will be in on Monday to sign the committee report. Thank you. Let's take it to a vote. Roll call vote, Ms. Ramona.
Yes, Chairman So, roll call vote on approving the legislation. Honorable Carl Slater, how do you vote?
Green.
Thank you. Honorable Carl Slater votes green. Honorable Paul Begay, how do you vote?
Green.
Thank you. Honorable Paul Begay votes green. Honorable Pernell Halona, how do you vote? Honorable Pernell Halona, how do you vote? Honorable Charlene So, how do you vote? Honorable Charlene So, how do you vote? Honorable Edison Juanica, how do you vote?
Green.
Thank you. Honorable Edison Juanica votes green. Chairman, we have 3 members voting in the affirmative, 0 opposing, chairman not voting, and 2 members not voting. Chairman?
Thank you, committee members. Honorable Begay, and Honorable Wanika. You make part of the backbone of this committee. Thank you for staying throughout this committee meeting. I appreciate it. Ms. Lorraine Spencer, please review with the committee the next item.
Mr. Chair and members of the HES committee. I believe that's the last item, so we'll go to item number 8, which is the close of meeting announcement and adjournment. Mr. Chair.
Thank you, committee members. If you leave it at my discretion to, if there's any urgent matters between now and November 9th, the chair give the latitude to the chair to convene a special meeting if necessary. I would ask that of the committee as a matter of before adjourning.
Chair, I would support that. And then I'd recommend maybe we bring back the ICWA program as a report and we can have a further discussion on their the proposed changes in the legislation. I appreciate you being accommodating to the situation.
Yeah. Committee, we have a motion. Honorable Edison Wanika.
Thank you, Chair. The only thing, I don't know, we had our advisor working on this was the meeting with Hunters Point. I think she's just trying to get the dates in place. So I don't know if that's going to be before the November 9th or whatever. But that's the only question I have.
Mr. Chair?
Okay. Yes, Ms. Angelita Benali.
Yes, Mr. Chair and Honorable Delegate Wanika, I am working on that meeting date. I have previously, I think it was even last month, I followed up earlier this month with the principal at Hunters Point to recommend a date. What she has to do is she has to work with her school board to see their availability, and then they decide a date. And I asked her to please, select 2 that everybody's available from Hunters Point and send it to me. And so far I haven't received a response, but I know it takes her a while because she has to go through several hurdles, I think, to have the school board approve such a meeting and attend it as well. And another thing, Mr. Chair, I have completed the committee report. I'm going to email it to Ms. Spencer and she'll print it out and put it in your mailbox. Thank you.
Thank you, Ms. Benali. We appreciate your work even though you're on sick leave. The committee will combine that expression of latitude with the motion to adjourn. So with that motion, Honorable Slater and Honorable Wanika, are you open to combining those 2 items into your motion to adjourn?
Yes, Chair.
Hakushila, Honorable Vice Chair Slater, open to that?
Can you repeat that, Chair?
To combine the giving the chair latitude to schedule a special meeting if necessary before November 9th, and then also to include a motion to adjourn as
Yes.
one motion?
Yes.
Okay. So with that, Miss Ramona, please provide us the roll call vote. And thank you to our substitutes for today. We appreciate your call to duty, Ms. Spencer and Ms. Ramona. The work of the council continues no matter what. Ms. Ramona, go ahead.
Oh, thank you, Chairman. So a roll call vote on the adjournment. Honorable Carl Slater, how do you vote?
Green.
Thank you. Honorable Carl Slater votes green. Honorable Paul Begay, how do you vote? Honorable Paul Begay, how do you vote? Honorable Pernell Halona, how do you vote?
Glenn votes green.
Thank you. Honorable Pernell Halona votes green. Honorable Charlene So, how do you vote? Honorable Charlene So, how do you vote? Honorable Edison Juanica, how do you vote?
Green.
Thank you. Honorable Edison Juanica votes green. Honorable Paul Begay, how do you vote?
Green.
Thank you. Honorable Paul Begay votes green. Honorable Charlene So, how do you vote? Chairman, we have 4 members voting in the affirmative, 0 opposing, chairman not voting, and 1 member not voting. Chairman?
Thank you. And committee members, be safe if you're going to other meetings, safe travels. And much gratitude for your work today. As I stated earlier, thank you to the staff. This work of the committees could not progress without your devotion and dedication. So we are adjourned at 4:32. Thank you.
Thank you, Chair.
Thanks, Chair.